Here, few question and answer about the heart failure. The question 1, SC inhibitors are a central part of the treatment of heart failure because they have more than one action to address the pathological change in their disorder. Which of the following pathological change in heart failure is not addressed by SC inhibitor? Activation of the sympathetic nervous system that increase the heart rate and preload. It does not address by SC inhibitor. One of the three types of heart failure involve the systemic dysfunction. Potential cause of this most common form of heart failure include. Question number 2 it is. So what is the answer? What are the cause of heart failure? Myocardial ischemia and injury secondary to the myocardial infarction. So when blood supply is reduced to the cardiac cell, we call myocardial infarction. It is the necrosis lead to the ischemic change and injury occur. Question 3. American Heart Association and American College of Cardiology have divided a classification system for heart failure that can be used to direct treatment. The patient with symptom and underlying disease is classified as. So stage 3. And diagnosis of the heart failure cannot be made by symptoms alone, since many disorders share the same symptom. The most specific and sensitive diagnostic test for the heart failure is two-dimensional echocardiogram that is identify structural anomalies and cardiac dysfunction. Treatment for heart failure, including drug therapy, based on stage developed by ACE or ACH. The stage A patients are treated with drugs for hypertension and hyperlipidemia if they exist. Stage 1, we could start the medication. Class 1 recommendation for stage A heart failure include treatment of thyroid disorder, especially if they are associated with trachyarrhythmias. Stage B, patients should have beta blockers added to their heart failure treatment regime when they have an ejection fraction less than 40%, when they have had a recent MI, both cases. Increase the life expectancy for the patients with heart failure has been associated with the use of SC inhibitors, especially when start early in the disease process. Stage 3 patient usually require a combination of the 3 to 4 drugs to manage their heart failure. In addition to SC inhibitors and beta blockers or diuretics may be added. Which of the following statement about the diuretics is not true? So diuretics, we use sometimes more than one drugs regimen. Diuretics forms the potassium sparing class should be used with ARB, angiotensin receptor blocker. Potassium sparing means spironolactone and ARB never ever used together. It is dangerous for the patient. Digoxin has very limited role in the treatment of heart failure. It is used mainly for the patient with audible SC sound. Which of the following class of the drugs is contraindicated in the heart failure? Calcium channel blocker. Calcium channel blocker is a contraindicated for heart failure patient. Heart failure is a leading cause of death and hospitalization in older adult, particularly greater than 65 years old. The drug of choice for greater than 65 years old is SC inhibitors. So diabetic with hypertension, SC inhibitor, right? So more than 65, SC inhibitor. SC inhibitor are contraindicated in pregnancy. Even angiotensin receptor blocker also contraindicated for the pregnancy. While treatment of the heart failure during the pregnancy, the best done by the specialized doctor, which of the following drugs class are considered safe during the pregnancy? It is beta blocker. But beta blocker is contraindicated if patient has a bronchial asthma or diabetic. But they're safer during pregnancy. Heart failure is a chronic condition that can be adequately managed in the primary care. However, consultation with cardiologist is appropriate when symptom markedly worsen or the patient become hypotensive. There is evidence of progressive renal insufficiency or patient regime symptomatic on optimal dose of SC inhibitors and beta blocker. So all of the cases we could not refer them to the cardiologist.